Welcome back to Focus on Health. If you're just joining us right now, we've been talking about diabetes. And remember that today is the 26th of March and it is the World Diabetes Day. And we are with Dr. Podi. Dr. Podi, how is it?
Well, I think so far it's good. We're having a good conversation.
Yes.
And I'm liking it.
Yeah. And right now we're going to talk about the diagnostics and of course the tests. So how do you do it and what goes into it?
Okay, I think over the years, diagnosing diabetes has not changed much. Usually there are a series of tests that we do to confirm diabetes. In particularly, about 95% is diabetes mellitus type 2. So let's train a bit on that because I think it's what affects most of the age groups. As you can see, some of the statistics, about from age 45 to 65, they are about 70% of the cases of diabetes. Less than 45 years is about 20%, and above 65 years is 10% of the cases that are diagnosed. Now, for diagnosis, very simple. Just walk into any clinic, tell them you want to do a urinalysis. Urinalysis is whereby they test the urine if there is any sugar or if there is any proteins that are being secreted from the urine. Now, this could indicate that there is diabetes, but not always. Some infections can also cause sugar to be in the blood. A second test that is more precise is monitoring of blood glucose. Blood glucose we usually monitor as a fasting sugar and also a random sugar. Random sugar means when you have already eaten, so it's called a random sugar test. But when you have not eaten anything prior 8 hours to a sugar test, it's called a fasting test. Now, for a fasting sugar, the normal levels are about 3.5 to 6.9. After eating, 2 hours after eating, this sugar can rise up to 7.8 millimoles per liter. For random sugars, the same, if it is a diabetic patient, you'll find that the sugars are above 11. So it could be 14, 15, indicating that there are signs of diabetes. Now, after the sugars are showing high, we usually do a glucose tolerance test. This is whereby a patient walks into a clinic, a fasting sugar is taken, and after this he's given 75 grams of glucose. And after 2 hours, we usually take a repeated reading.
Yes.
And if this repeated reading is more than 11, then we can say there is diabetes.
Yeah.
Another very precise test is glycated hemoglobin. It shows an average of the blood sugar for almost 2 to 3 months. Now, normal would be about up to 6.5%. More than 6.5% indicates there is sign of diabetes.
Yeah. And all those are tests, but do you think, Dr. that we'll get to a point where with the coming technology is really taking over? Do you think that we'll get to a point where we'll have non-invasive tests? Technology is really coming in with applications pertaining that they can now test. They can now be able to test these just through a button on the phone.
It's true. There are so many ways, invasive ways, that non-invasive ways that have come up.
Just for our viewers, what does non-invasive mean?
Non-invasive means tests that do not involve any needles,
Yes.
do not involve any cutting,
Yes.
or anything like that.
You
Now,
can
one thing good is monitoring your pressure,
Yes.
because hypertension is also proven to be a high risk in diabetes. Not only in diabetes, but also kidney failure, cardiovascular diseases, and also cerebrovascular diseases.
And now when we talk about the complications, what is some of the complications that can arise from having diabetes, especially if it is not treated or controlled on time?
Okay, if sugars are not controlled, I heard you saying diabetes is a silent killer.
Yes.
And the reason being, the complications arise over a long time. You do not understand the disease until the complications come.
Yes.
Now, the various complications include diabetic retinopathy,
Yes.
which includes destruction of the blood vessels of the eye. Another destruction is nephropathy, which can lead to kidney failure. Apart from that, as we said earlier on, that wounds in diabetes heal a long time. So even when a patient comes to a clinic, it's good to look at the extremities of the upper and lower limbs to see if there are, mainly the feet, to see if there are any wounds that are taking a lot of time. Another very important complication is neuropathy, whereby the peripheral nervous system is damaged, so which causes a loss of sensation, sometimes can cause even coma.
And all this is when we do not handle it in the initial stages, right?
Yes, when you are diagnosed with diabetes, you have to control your sugar to the maximum, or else the complications may arise.
So now let's talk about the prevention of diabetes then, because for something that has something that is really killing, then we also have to have ways of preventing it. Dig in on that.
Okay, there are many ways one can prevent, but it is individual. One thing that I said, that if there is a family history of diabetes, then you should know that you are susceptible to getting the disease in your old age. So from your young age, you should start avoiding a lot of refined carbohydrates. Stay away from bad habits such as smoking and alcohol. At the same time, be doing some activities. Don't be a couch potato. Don't become obese. Yeah? As we see in Kenya, almost 1 in every 25 people are diabetic, or they have pre-diabetes. Pre-diabetes is whereby you are very susceptible to getting diabetes in your old age. So another thing that would matter is also population education. People should understand that what they are consuming in the long run is not healthy for them.
What about the treatment?
Now,
so when somebody has already diabetes, so you as a doctor, what do you advise and what is the way forward for the patient? Does this mean that this is the end of him or her?
Diabetes is not the end of life.
Yes.
Medication usually is divided into 3. There is what we have, the diet and lifestyle change. The second one is oral drugs, and the third is insulin therapy, which is injectables. Now, each patient, as I said, is individual, and you have to have an individual approach to each patient. Now, maybe the sugars are slightly high, as pre-diabetes we were saying. For such a patient, I would recommend a diet change and a lifestyle change. For a patient who is already diagnosed with diabetes, we have classes of diabetic drugs. Now, we usually follow a scheme whereby there is monotherapy and then there is combination of drugs. Mostly used drug is metformin, which also goes by the name as glucophage. It acts by reducing blood glucose and stores it into the liver. Other drugs, now if a patient on monotherapy, that is only one drug, for 3 months does not react to the medication, then we either combine with another oral drug, and if oral drugs do not work, then we go to the final decision, which is insulin injectables.
As we come to the end of this, Dr. Do we have any do's and don'ts that this patient should be focusing on?
Okay, the do's: start some activity, walking. Usually, walking every day 45 minutes is healthy for you. It keeps your body strong, keeps your heart running, controls the pressure. Another thing for pressure, reduce salty foods. A lot of oily foods cause high cholesterol, also can give rise to complications. The don'ts, as I'm saying, avoid all bad habits. A lot of smoking, a lot of alcoholism, increasing body weight could also be one of the factors. that cause.
Any final words, Dr. This being the World Diabetes Day today, what a luck for us is Focus on Health here on KUTV.
I think one of the main things as a doctor I would like to say is that people should be very keen on their health, take care of themselves, take care of their families, and advise each other. I need to create awareness of diabetes, and if any of your family members has diabetes, please show them moral support, give them that extra energy so that they can
Push on.
Yes.
Thank you very much, Dr.
You're welcome.
Yeah, and I hope people are at home and now available, are now able to know what diabetes is all about. And we thank you very much for coming into the show with us.
Oh, thank you very much. I hope we've changed the life for somebody somewhere.
Yeah.
And as a doctor, I mean, it would be
nice, such a nice feeling.
Nice feeling for me, yes.
Yeah. That's all we had for you here on Focus on Health. Till next time, I've been your host, Oumo Nyango, but now I'll leave you with the Did You Know segment. Till next time, cheers.
Foods to avoid: grains, dairy proteins, fats, sugars, and carbohydrates.